Okay. Hello there. Good morning, good afternoon, good evening, wherever it is that you're joining us from. Thank you so much for joining us. This is Livinghealth TV live with me, Dr. Gbenga Adebayo, and we are here today to discuss something really interesting, something fantastic, something that you may not. Uh, be worried about. I hope you're not worried about it. Or even if you're not worried about it, he may be worried about you, depending on what you're doing, as we shall be discussing, depending on how you live and what you do, and even on what you do, what somebody else does may affect you. So, thank you so much for joining us. If this is your very first time, a pleasure to have you. If you've not subscribed to, you're not subscribing or you have not followed, as we started upper week, we trying to see if we can expand Living LTV Live to more platforms. So we have it on YouTube and we also have it on IG. And today we are discussing the burden of STIs, sexually transmitted infections, the crisis of sexually transmitted infections, and how you can keep yourself safe and your loved ones, how you can keep yourself and your loved ones safe. That's what we'll be discussing today on Living Health TV Live. And it's strange, it's interesting. Many years ago, many years ago, when we discovered antibiotics, we felt that the world felt that, well, we're going to see the end of all infections. That people discovered the penicillin, but in fact was groundbreaking invention, groundbreaking discovery, accidental discovery. Nevertheless, groundbreaking discovery that changed the face of how you manage infection. So it was just no that if you had something so simple that could wipe and cure infection, people thought that we're going to see the end of all infections very soon. We are very far from that for various reasons that we may not be able to talk about today. But lo and behold, infections are still here with us, and new infections every day, viral infections, bacterial infections, fungal infections, all kinds of infections. They are still there causing and wreaking havoc. In fact, we're really worried about the fact that we are not coming up with new agents quickly enough, the way these germs are overcoming the agents that we currently have to manage them. There are people with infections now on the face of the earth that there is no drug that can control the infection that they are grappling with. And that's scary. That's really scary. That you will live with that infection all your life and probably die from that as a complication of that infection, depending on the nature of that infection. And of course, sex is part of human existence. People, for various reasons, uh, want to have sex, do have sex, and we can't stop that. It's a biological need. However, we can work at controlling sexually transmitted infections. The alarming reality is that there are so many people right now walking on the face of the earth carrying one sexually transmitted infection or the other, and they are totally oblivious of it. They don't know. They don't know that they are carrying an infection, and so they are just distributing it as they have uh, sex with their partners. And these infections, some of them are really dangerous, deadly, can kill, and cause a lot of harm. Even some will cause inconvenience, a lot of inconvenience. The statistics are very shocking. 1 million people, welcome, sir, thank you. 1 million people every day get infected with an STI. 1 million people, 1 million people every day. Over 1 million people. And the vast majority of these people, they don't know that they have an STI. That's a lot of people. They just go about. So it's a crisis. a crisis that a lot of people don't know about. They're not talking about. They are unaware of it, and it's festering there. So when we have syphilis, you have gonorrhea, you have chlamydia, you have herpes, right? And herpes no cure. Hepatitis B is not, it's a sexually transmissible infection, but it's one of the ways that you can contract it. And all these things are there. They are all diseases, huge burden, right? Hundreds of millions of people struggling with one STI on the other. Like I said, 1 million new infections every day. 1 million. That's a lot of people. Think about it. Before I'm done today with this presentation, so many people, hundreds of thousands, or maybe I'll say thousands of people, not hundreds of thousands, because I think I'm not going to spend 2 hours, right? Thousands, tens of thousands of people are going to come down, are going to contract an STI. That's a problem. That's a problem. Another problem, you might say, I am cool. I don't sleep up and down. I don't have sex up and down. If you don't have sex up and down, what of your partner? I know I saw something somewhere, somebody's page and somebody's wall, and it was saying that it is acceptable for men in the society to be promiscuous, but it's less acceptable for women. That why is that? So, and people are giving various reasons as to why they think that is the case. Well, if you are faithful to your partner and your partner is not faithful to you, or your partner for one reason or other, you can get a sexually transmitted infection. And in fact, for many people, that's what is their condition. That's how some people have contracted, even the ones that people are scared about, HIV and all the other infections out there. So it is important for there to be increased awareness of this burden. People will do what they want to do. Now, human behavior is complex. It's difficult to change people. It's difficult to tell people, do this, don't do this. People will do what they want to do. People tend to do what they want to do. Now, the question now is, are there steps, are there things that we can do to control this scourge? What are the things that we can do? One of the things that we can do is what we are doing on Livinghealth TV Live today. Increase awareness of this problem, right? We are commemorating STI Awareness Week. A lot of content being put out there across our social media feeds on Livinghealth International and our allied network of clients that we work with to help them push this message out there. Everybody needs to be more aware of this scourge, of the thing is just there. Cancer, right? You can get cancer from an STI. Cervical cancer is largely caused by the human papilloma virus, which is transmitted through sex, right? The HPV virus, HPV, the human papilloma virus is what causes for many people. So some people actually think that I propose and have said that cervical cancer is a sexually transmitted cancer, right? And it can be cured. It can be prevented, right? If we give all young girls, before they start being sexually active, the HPV vaccine, we can make a lot of them to be protected from developing contracted cervical cancer, right? Very, very important. So the things that we need to do, number one, like I said, awareness. More and more people need to know about this scourge, this problem confronting us. So a lot of people that you're working with are playing with. Some people, you see them that they have cold sores. They just have sores. They say it's malaria. For some of them, It's HPV. It's not HPV, it's herpes. It's the herpes simplex virus, right? That is giving them those cold sores. Because it will come, and herpes virus, no cure, right? You just keep having cold sores. You see having sores in your genitals. It can be really, 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 really debilitating. It can be debilitating. So awareness, increased awareness of all these conditions, chlamydia. You need to know what. So if you have a sore on your private part, on your genitals, and it's not paining you, don't be afraid. Because a lot of people, once they still, even when they start to have symptoms, they don't go for treatment because they are afraid of what people may say or may not say. Please go for treatment. You have a sore on your private part. Somebody asked about that last week. I just have a sore, a painless sore on my private part. What should I do? Go for treatment. Let's find out what it is. Is it syphilis? Because a lot of these conditions, they may not give you problems now. Syphilis may not give you problems after the initial problem. It will just keep festering. And many years down the line, you have serious complications that can kill, that do kill. Gonorrhea, you may treat it and you don't treat it properly, you stop having symptoms. You start to distribute gonorrhea, and if you are a man, you cannot have urethral stricture. It becomes hell to pass urine. Difficult. You and that, if you see it, and it's difficult, really difficult to treat, painful to treat, right? Surgical interventions and you can prevent all that by treatment, effective treatment. So I've started from awareness. Let me not jump to treatment. Don't mind me. It started from awareness. After we know about this problem, if you are just joining us, thank you so much for joining. We're looking at the bodies of STIs, and you may think it doesn't concern you. It may actually concern you. You can have an STI and not know about it. And a lot of people within open liberalization that we have in our society, 1 million people every day, 1 million people catch an STI. That's a lot of people. That's a real lot of people. So we need to know about this problem, and after knowing about this problem, prevent it. Right? Prevention. We will say an ounce of prevention is worth a ton of cure, right? Prevention is always better than cure. So ABC, still that same ABC that we say abstinence. You cannot catch an STI if you are not having sex. You can catch other things, right? You don't need to have sex to catch viral infection, maybe COVID, like that. So, but of course, if you are not outside in the rain cannot beat you. Right? If you are not outside in the sun cannot beat you. So if you can abstain, of course, this is very difficult for many people to do. This is not a practical solution for many people to adopt to. I wish more people, but that's just so. A is abstinence, and people actually do that. But if you cannot do that, we cannot expect everybody. We cannot expect everyone to abstain. So we now say, what is it? Because it's just human nature. Human nature will do what it wants to do. B is what? Be faithful. Be faithful, right? This is also quite difficult for people for one reason or the other. And some people may think it's male. Even females, yes, anecdotal evidence suggests that men are more. Yes, man. It's people are in this age. The abstinence, be faithful. Well, some people are pretty faithful. I like to think so. A lot of people out there are being faithful to one partner. Now, when we say be faithful, uh, there's something also called serial. Some people. So let me ask you a question. If a man has 4 partners, or a woman has 4 partners, right? And stays with those 4 partners for the year, and someone that has 1 partner at the time and then has 4 partners over the course of the year. Really faithful to those 1 at a time, but has 4 partners in a year. Who is more likely to catch an STI? Right? If you have an answer, you can just type the answer in the chat. Who is more likely? Somebody that has 4 partners, 4 partners at stays with those 4 partners, or somebody that has 1 partner at a time but has 4 partners in the year. Who is more likely to catch an STI? You may think that the person that has 4 partners is more likely to catch an STI, but that's not actually the fact. The fact of the matter is that that person that has 1 partner at a time or has 4 partners in a year is more likely to catch an STI. Why is that so? Because, especially if they are not using protection, because that person that has 4 partners in a year has stayed with 4 partners. But the person that has 1 partner every 3 months, those people that is also having sex with, those ones too often will also be people that are rotating with more people. So because if you are not using protection, you are, whatever that person has, if it's untreated, you are more likely to catch it. So the chances of your network of partners, if I can put it that way, your network of partners are higher if you have been having serial. So we may say I'm having 1 partner, but I'm having many partners. So if you have been having many partners, you're just revolving partners. That partner too has just come from someone who has come from someone who have come from someone. So that network puts you at greater risk. And the person that has stayed with 4 and those 4 have stayed with him or that. So be faithful. Be faithful. You be faithful and your partner be faithful to you. That reduces your risk of exposure and contracting STIs. And then, of course, the C that we say is condom. Condom. Use protection if you are not in a relationship where you think or where you are sure, where you are certain that you and your partner are faithful with one another. If you are faithful, if 2 people are faithful to themselves, then and that person doesn't have STI, this person doesn't have STI, then STI will not enter the mix. But where that person is there, but where that person is playing, doing all kinds of stuff, you can now introduce an STI into your relationship. And don't take your symptoms for granted. You have an itch, you have a discharge that is not normal, that's not part of what you see. You have lumps growing. Go treat it. Don't just ignore it and say, oh, it was paining before, it has stopped paining me now, and then it's fine. No, it's not fine. It's not fine. And like we said, a lot of STIs are asymptomatic. Nothing, you will not get any sign. You won't know anything has gone wrong with you. And it's there first train, and you start to transmit it. So A, B, C, and treatment. Treatment. Let's get treatment, and let's break the scourge of shame and silence. If you have an STI, you have it. Get treated. And if it's HIV, you have HIV. In this age and time, you can have HIV and live a fine life. And even once you are using your medicines, with HIV medicines that we have now, you can get to a state that you can't even transmit. Once your viral level becomes undetectable, you are suppressed virally, you have viral suppression, that person becomes just like the other person. But that only happens if you are using your medicines. Use your medicine. So, do you have HIV? I have friends that have HIV. I know folks that have HIV. And sadly, I also know people that have had HIV and They passed on by not using their medicines, and not. And so you can live a good life. So whatever STI that you have, whatever infection that you have, the important thing is for you to go for management, for you to go for treatment, and make sure you treat. So let's spread the message. 1 million people every day. In the past 20 minutes, I've been speaking. Thousands of people have contracted an STI, and many of them won't know about it, right? They just won't know that they've caught something, and then they go on to give somebody else, go on to give somebody else, go on to see other. And we are running out of medicines to treat people. A lot of resistant, multi-resistant infections out there. So let's sort it out, right? Let's sort it out. So if you have questions, please go ahead and put your questions about STIs or any other matter, open to answering them. Put them in the comment section. If you are watching on Instagram, Facebook, catching after, seeing this after, thank you for catching up. On YouTube, of course, subscribe if you're not subscribed to our channel. Share this with people. Let's create awareness. Let more people know about this scourge and what we can do to prevent it. So awareness, let people know about it. Let's follow the ABC of prevention, right? Abstinence, be faithful, use protection, use a condom, right? And then please treat and see your physician, talk to your physician, whatever it is that is happening to you. Don't keep quiet about it, right? Thank you so much for joining us. I'm grateful. Thank you everyone that's tuned in. Until I come again next week Friday, by the grace of God, stay healthy, stay healthy, stay inspired, put your body inside cloth. Remember I say, life, you don't get duplicate. God bless you.